my name is Jill Sevier. I have been a physiotherapist with Eastern Health, St. John's, Newfoundland for over 30 years. Over the last several years, a large portion of my practice has involved assessing and treating patients who have had breast cancer surgery. I know that much of the information that we provide preoperatively to our clients becomes a bit of a blur for the individuals undergoing the stress and the trauma of cancer treatment. So to help you remember what you have been advised, we decided to create the following video as a guide for use during your early days of recuperation to help you to return to full function. This video is for patients who have undergone a mastectomy and/or lymph node removal. It is not intended for people who have had reconstructive breast surgery. The guide is not intended to replace, but rather to supplement the information provided by your healthcare team. If you have difficulty with any of these exercises, we recommend that you review them with a physiotherapist who is familiar with this practice area. Certainly, if you have any of the following symptoms, please see your healthcare provider immediately. These include fever or shaking with chills, increasing redness around the incision or into your arm, opening of the wound site, signs of pus or infection at the wound site, shortness of breath or difficulty breathing, increased pain in the chest or under or down the arm, lessening of movement or inability to regain your preoperative range of movement within 6 weeks of your surgery, increased swelling in your neck, arm, or chest, which may require assistance of a lymphedema nurse or healthcare specialist. Some patients will experience additional referred sensations. These sensations occur because the nerves in the skin have been affected by your surgery. The feelings and locations will vary with the individual, but may include sensitivity, numbness, tingling, twinges, and burning in any of the following areas: the armpit, shoulder, arm, shoulder blade, chest, and/or neck. These are normal sensations and will diminish over time as the nerves heal. Although it can be very frightening to move your arm after your chest surgery, doing so in a controlled manner will help you to heal. Conversely, not moving will lead to poor healing. The benefits of early exercise are numerous. It improves the circulation to the area of surgery that is healing, bringing nutrients to the tissues while taking away the waste products. Exercise allows tissues to heal at the proper length. Tissues will shorten if not stretched. Exercise prevents scars from adhering or binding down to the chest wall, which would cause limitations to chest and arm movements. Exercise allows you to recover your full movement and your full function of your arm so that you can return to your daily activities. Exercise reduces tension and pain. It helps to reduce the risk of arm swelling or lymphedema. And exercise generally makes you feel better by increasing energy levels. We begin by reminding you of good posture in sitting, standing, and lying, and we review breathing exercises that can be done throughout our exercise program. Next, we review early circulation and flexibility exercises to be started immediately following your surgery. We add further stretches to begin at day 2 after your surgery. We go on to some more advanced stretches that you can begin when your incisions are healed to get back your pre-surgery movements. Next, we review some basic strengthening exercises that can help you to regain your arm function and improve your posture. These are begun when your incisions are well healed and energy level is improved. We also provide some tips on how to progress your exercises. In this section, we would like to review postural correction, and we will review correct posture in sitting, standing, and lying. This is important to improve your breathing, to decrease stress to the neck and the back, to improve shoulder mechanics or the ability to move the shoulder, to enhance circulation into the chest and the arm for better healing and to reduce the risk of swelling. It also helps to ensure that the tissue across the chest heals at the proper length. After surgery, it is very common for people to want to bring their shoulders forward and their arm across their chest to protect the area that has had the surgery. This does not help with the circulation, and being aware of the correct posture helps to counteract the tendency. First, find a chair that is most supportive to your back and your arms, that fits you. We would suggest that you avoid sloppy cushion chairs, things that you sink back into like a C. You can enhance your posture by just choosing some extra pillow supports. The first thing to try is a lumbar support or a rolled up towel in the small of your back in the lumbar curve. This can be just a hand towel that's rolled up with a couple elastics and put in the low back so that you can relax back into the chair with that supporting your back. Using the lumbar roll helps you to lean back into the chair and open up your chest, and as you do this, you actually get more range of motion of your arm when you lift it up. Using a pillow under your arm can help to make it feel more comfortable, opening up the lymphatic pathways, but also taking the pressure of your arm off of the incision area. To help to avoid your arms dragging forward, it's good to have the armrests supporting your arms at the right height. These can be adjusted by putting pillows underneath the arms, again so that your shoulders are relaxed back and down, not too low, but again not too high. Your chin should be tucked in, and you can think long in the neck as if there's a string pulling from the center of your head towards the sky, and your feet should be relaxed flat on the floor in front of you, or if necessary on a stool in front of you. Correct standing posture involves proper weight distribution equally through the arches of both feet. Should be standing tall, lengthening your spine. The chin should be tucked in, ears should be over your shoulders, and shoulders should be back and down. The knees slightly bent, not locked. A mirror helps to give feedback about your symmetry, your posture, and your shoulder positioning. Looking at the body from the side view, a plumb line dropped down beside you should run through your ears, through your shoulder, through your hip, through your knee, and just in front of the ankle. There should be a slight inward curve at the neck or the cervical spine, a slight outward curve where the thoracic spine is, where the ribs attach, and a slight inward curve at the lumbar spine or the low back. In side lying, the goal is to support the spine in a straight or neutral position. Choose a supportive pillow that maintains your head in a neutral position in line with your spine. Too high a pillow stretches your neck on one side and compresses it on the other, leading to neck strain. A pillow under your affected upper arm may improve comfort, and a bulky pillow placed in front of you can be used to cuddle for support to reduce the drag of that arm. You may also choose to place a pillow between your knees to support your spine in the neutral position. In lying on your back, a pillow should be chosen that doesn't allow your head to be pushed too far forward. You want to support the arch of the neck, but not push your head into a flexed position. If you have any swelling in your arm, it's a good idea to stack the pillows beside you to allow your arm to be elevated. For further back comfort, you may choose to use a pillow underneath both of your knees to slightly flex them. Deep breathing, although a basic exercise, is an important part of your recovery. It helps to expand your chest wall, keeping the chest tissue mobile. It keeps the lungs clear and also aids your circulation by bringing oxygen into the body and helping pump the lymphatic system. It can also help to relax the body. To practice this exercise, you can try lying on your back or sitting in a supportive chair. Place one or both of your hands across your belly and take a deep breath in slowly. You can do this through your nose or through your mouth, whatever you feel most comfortable with. Feel your belly rise under your hands like you're filling up a balloon from the base of your lungs upwards. As your lower ribs expand outward and backward, feel the chest expand. Do not tense your shoulders or your neck. Hold that breath for 2 seconds and then relax, letting your air out slowly and completely. You should feel your tummy fall inwards under your hands as you're breathing out. Repeat this exercise 4 or 5 times slowly. And every time you take a breath in and out, let your mind and your body relax. This can be done many times throughout the day to help release tension.
first set of exercises are circulation exercises, recognizing that the heart pumps blood fluid to the tips of the fingers and the toes. It's the muscles that help to pump the fluid back into the central circulation. So the first exercise is just using a ball or a sponge, something in your hands, to squeeze to make a fist. Hold it for 1 or 2 seconds and then release it. And then again, tighten it up, hold it for a couple seconds and release it. The next exercise is wrist bends or waving. And you can do this in 2 directions, just a straight up and down movement of your wrist, like a regular wave. Or you can also do it side to side, like a queen's wave. Hold each position for 1 or 2 seconds and repeat it several times. Because after breast surgery, we tend to hold our arm in a protected posture across our stomach with the elbow in a bent position, this next exercise is to help to ensure that you don't get a stiff elbow. So in standing or in sitting, bend and fully straighten your elbow, making sure that the crease of the elbow is fully stretched. And then bend your hand up towards your shoulder, fully flexing the elbow, and then straightening it out again. Hold each position again for 1 to 2 seconds and ensure that you're breathing at the same time. A further exercise that you can do with your elbow is what I call begging for money and throwing it away. So turn your palm up, facing the ceiling with your elbow in a bent position, and then turn your palm down to throw away the money. And do this again slowly, holding for 1 or 2 seconds, and breathe as you do it. The next exercises are for your neck. The first one is for neck rotation. So sitting comfortably, your shoulders are relaxed down. Turn your head to one side until you feel a gentle stretch. Hold that for 1 or 2 seconds, and then turn to repeat to the other side. Hold that for 1 or 2 seconds and ensure that your shoulders are lowered and that you're breathing. This can also be done in lying. Neck side bends are the next exercise, and this one again can be done in lying or sitting. Tilt your head toward one's shoulder until you feel a gentle stretch on the opposite side. This can be facilitated by putting your fingertips up at your temple to hold the weight of your head so that you're not stressing as you tilt to the side. Again, hold this for 1 or 2 seconds. Keep breathing as you do it. Slowly reverse and repeat to the other side. The next exercise is a really good one for relaxation across the shoulder area where we tend to build up a lot of tension. You start with your shoulders relaxed and then raise them up towards your ears. Hold them a little bit tightly for 1 or 2 seconds and then relax. And make sure that you totally relax your shoulders so that they're not halfway down, but they are fully down. The next exercise is the shoulder blade squeeze. This one is a very good one for improving posture and also for helping to heal the front of the chest in the right length, as we tend to shorten in the tissues when the incision is healing. You can imagine that you have an orange in between your shoulder blades and you're going to make orange juice by squeezing the shoulder blades together in the back. Gradually pull the shoulders together, hold, count for 1 to 2 seconds, breathe as you do it, and then gently relax your shoulders. Another image is to think of your collarbones as being bird wings, and you're trying to make them stretch out on either side of your chest to make the bird soar. Repeat this a few times. The next exercises can be started 1 to 2 days after your surgery. They can be done many times throughout the day, and as your movement improves, they can be done less often.
The early flexibility exercises should be done slowly and gently until your preoperative movement is regained. Do not be afraid of a slight pull as you move. Breathe into these stretches. Do not, however, force range or push into pain. Additionally, for the first week or 2 after your surgery, or until your drains are out, it is recommended that you do not lift your affected arm higher than your shoulder height. We will remind you of this several times throughout our video. As you do more functional activities, you can replace some of these basic exercises with your normal activities. These would include such things as pulling a shirt over your head, or putting a cup on a high cupboard shelf, hanging light pieces of laundry on a chest-high clothesline, making light meals, or brushing your hair. Patients will usually regain their full range of motion by 4 to 6 weeks after surgery.
Can you remember back into your childhood and making angels in the snow lying on your back? This one too, you lie on your back with your shoulders back and down. Place your arms out to your side with your palms facing up. Bring your arms up to shoulder level. Again, for the first week or until your incision is healed, only up to shoulder level. You may begin to lift your arm higher or above the shoulder level as you feel more comfortable. Hold for 5 or 10 seconds, breathe as you're doing it, and then gently lower back to your side. Do this with both arms so you can compare the range of motion. This exercise can be done lying on your back with your knees bent, and if you hold on to a cane or a broomstick, it makes it easier to do your arm lifts. Keep your elbows straight, clasp your hands over the stick, and lift your arms up, first of all, just to shoulder level. You may begin to lift your arms above shoulder level as you feel more comfortable and as your incision is healed. This will become easier when the drains are removed. Hold the stretch for 5 to 10 seconds. Keep breathing as you're stretching and progress as you feel able. Slowly lower the cane or broomstick and then repeat again. While you're doing this exercise, make sure that your back is flat and that your shoulders are back and down, as well as breathing throughout the exercise. For support at the end of the range of motion, you can place some pillows by your head so that your affected arm can relax back into those pillows and get a little bit more stretch. The next exercise is the towel stretch and is to help you to improve your range of motion of your rotation of your shoulder. Stand up tall and hold the towel behind your back with one hand at the neck and one hand behind your back as if you're going to dry your back. Slowly pull the lower hand up toward the middle of your back and then reverse, so you're pulling your upper hand down towards the neck. Switch hand positions and repeat in the opposite direction. The next exercise is for the upper chest stretch and is done in lying with your knees bent and the small of your back flat against the bed. Place your hands beside your ears with your elbows pointing toward the ceiling. Slowly move your elbows away from your face as far as comfortable. You can place a pillow underneath your elbow or even 2 pillows if it's too much of a stretch to allow your elbow to relax back into the pillow, and this will help you to comfortably relax the chest. Hold for 5 to 10 seconds, keep breathing, and progress as you are able, gradually taking out the amount of support that's under your elbow. The next exercise is a finger walking across the table exercise, and this can be done out in front of you and also out to the side for improving your range of motion. Remember again the 90-degree rule, where you don't want to push further than that for the first week or so after the surgery until the incision is healed. Sit comfortably beside the table, put your arm on top of the table, and gradually walk your fingers forward until you feel a gentle stretch. Keep breathing as you do this exercise and keep making sure that your shoulder is back and down. The next position of the finger walking is sitting side onto the table and walking your fingers directly away from you. So you can walk them across, try and mark a spot, and then next time try and go a little bit further and a little bit further. You have to lean towards the table as your arm gets out further. Again, it should be done to the point that you're feeling a gentle stretch, but not pain. Wall climbing is a slightly harder version of the finger walking across the table exercise. This can be done by standing facing a wall about an arm's length away. Slowly walk your fingers up the wall, progressing by stepping towards the wall to reach to the highest position that you can. Again, you should feel a gentle stretch in your shoulder and across your chest, but not so that you're feeling pain. Keep breathing as you're doing it, and continue to check that your shoulders are back and down as you're stretching your arm up towards the top of the wall. Next, stand side onto the wall with your arm reached straight out to the side and slowly walk your fingers up the wall. Again, don't go higher than 90 degrees for the first week or until the drains are removed. Progress by stepping toward the wall to reach as high as you can. Full range would be actually getting the side of your chest right against your wall and the arm up above your head. Slowly relax and let your arm come down. This exercise is the upper chest stretch and be done at a door frame or against a wall. Stand facing the wall or door frame with your forearm laying flat against the wall. Turn your upper body away from the arm that's against the wall until you feel a gentle stretch across the chest. Remember not to do this higher than 90 degrees for the first week or so after the surgery. Then gradually you can start to reach your arm a little bit further up the wall. The further up the wall you reach your arm, the more you'll feel the stretch in the lower part of the shoulder. If you're out to the side, you'll feel it in the middle of the shoulder, and if you're lower on the wall, you'll feel it in the upper part of your shoulder. Keep breathing as you do this exercise, focusing on the breathing out. The next exercise is for shoulder extension or backward movement of the arms. It is made easier if you hold onto a rope or stick between the hands as you do the exercise. Stand up straight, shoulders back and down, elbows straight and by your side. Then gently lift the stick or the rope up behind you as far as is comfortably possible. Keep breathing as you do it, and if you can lift a little bit higher and a little bit higher as you breathe out. Then gently lower, relax, and repeat. The next exercise is an overhead stretch using a pulley with a rope. It can be used with a very well secured coat hook on a wall or a banister rail if you're sitting below the stair. Hold the rope in each hand and your arms should be out straight. Slowly pull down on the rope on the hand that is not affected to rise up the affected side. Again, keeping the elbow straight. You should feel a gentle stretch at the end of the movement, and again, not higher than 90 degrees for the first week or so after the surgery. Make sure that you keep your shoulders lowered and down, even as you raise your arm up towards the ceiling. Keep breathing as you do that. Slowly release, and you can repeat with the other hand. After you've repeated this exercise a few times going forward, you can do the exercise out to the side, much like the angel wing, bringing your arms straight out to the side and up towards the ceiling, again keeping your shoulders back and down and continuing to breathe as you do the exercise. Don't let your body lean to the side as you do this. The next exercise is a more advanced exercise in range of motion and can be done a few weeks after the surgery when the incision is fully healed. It can be done in sitting or in lying and helps to increase the movement of the soft tissue or skin across the chest. The start position is lying on your side with both hands straight out in front with the palms together and your knees bent up so that you're almost in a sitting position while you're lying. Take a deep breath, and as you breathe out, bring the top hand up and across your body so that it is working towards lying flat on the bed on the other side. Your hips and your knees shouldn't move at all with this, but your head should follow your hand. You can stack pillows beside you so that when you bring your arm out and across your body, you can relax them back into those pillows for support and getting a more controlled stretch. You can also try this exercise with your hands in different positions, so you can bring them up towards your ears and then bring them down and across the body in front of you to form one arm of an X. And then the next time, start with your arms down beside your thighs and bring them up and across towards your ears. So you do the other arm of the X. Keep breathing again as you do this, and do it slowly, keeping your shoulder blades back and down as you stretch, and follow your hand, your upper hand, with your eyes. Some find this exercise easier to do in sitting because there's less stretch with gravity of the arm. So if you do this in sitting, place your chair against the wall, keeping your knees parallel to the wall. Your arms are out in front of you, straight out in front with the palms together. Shoulders are back and down. Take a deep breath, and as you breathe out, bring the outer arm away from the other one to turn your upper body to face outward, away from the wall, eventually trying to get the arm that's moving as flat as you can against the wall. Keep breathing as you do it. Relax and stretch, and then gently bring your arm back. You want to make sure that you repeat this in each direction. Another more advanced exercise when you're able to lift your arms up over your head is to hold a stick in both hands and do some side flexion. This helps to elongate the tissues along the side of your chest. So holding it up with your shoulders back and down, gently tilt your body towards one side. Breathe into the upper side so you're letting those ribs stretch and lift, and feel the tissue across your chest letting go. Then gently come back to midline, breathing, and then going out to the other side. Hold it gently, breathe into that side, stretching it just gently, and then gently coming back to the middle again. The following set of exercises work on the rebuilding of muscle strength and help to reinforce proper posture. They should be done slowly and gently to the point of fatigue, but not to the point of strain. Remember that you should not lift more than about 5 pounds for the first few weeks following surgery. A general guideline of numbers of repetitions would be to start with 5 to 10 and do them a couple times per day. Exercises should be progressed very slowly to avoid pain or swelling, and this is in terms of weight increases or numbers of repetitions. The first exercise is using TheraBand, or an exercise elastic that can be made into a loop and put around your wrists. You want to make sure that you're sitting in a good posture with your shoulders back and down and your head tucked in. And then gently, with your elbows at your side, move one hand away from the center of the body. Hold it there for a count of about 10. Keep breathing as you do it, and then gently bring it back to neutral. Then do the other side. Holding it for about 10 seconds, breathing, no jerking with this movement, and gently releasing it back to the neutral position. You can repeat this again, 5 to 10 repetitions, and repeat it a few times a day. If you do this exercise correctly, the muscles that you should feel fatigue are the ones between your shoulder blades. These are the ones that help to turn your shoulders out. These are very important muscles that help to control your proper posture. Your elbows should stay into your side as your hands move apart. The next exercise is done for the biceps and triceps and also helps to work on proper posture. Start sitting in a very good posture with your shoulders back and down, your elbows are into your side, and the elastic is looped around both wrists. One hand is then brought up towards the same side shoulder, and the other hand is brought down towards the floor on the opposite side. Hold the tension on the elastic for 5 or 10 seconds, keeping the shoulders back and down and continuing to breathe. Then gently let the tension off and pull the elastic in the opposite direction so that the other hand is up towards the shoulder and the opposite hand is down towards the floor. Keep breathing again as you do it and repeat until your arms are gently tired. Another way of doing these strengthening exercises is to use dumbbells or small weights. What you want to do is start with 1 pound and then gradually increase as your muscles build up and your tolerance increases. The first one would be sitting in the same position as with the elastic, in a good posture with your shoulders back and down, and 1 pound weights in each hand. You can do this symmetrically, so both hands at the same time, or you can alternate. One hand being brought up towards the shoulder and then gently lowered, and then the other hand brought up towards the shoulder and gently lowering. So this works on the front of the upper arm or the biceps muscle. Continue to check on your posture as you do this exercise, because as you get tired, often the shoulders tend to round forward. So keep checking to make sure that they are back and down. To work on the triceps muscle, it's easier to do this in lying with the arm up over your head. You can hold on to the weight and bring the elbow up by your ear, then bringing the weight down onto the bed and then lifting it up again, straightening out the elbow. Do this slowly and keep breathing as you do it, counting to about 10, down, and then gently up again. You may find this exercise easier if you support the arm that's exercising with the other arm holding just below your elbow. Another exercise for strengthening the shoulder is lifting the weight out to the side of the body. This can be done with both hands together or one hand at a time, and again can be helpful for improving posture. So shoulders are back and down, you're sitting tall, the weight is held in your arm, and you're bringing it up towards shoulder height, counting to 10, keep breathing, and slowly lower. You can do one hand at a time, alternating, or do 5 to 10 repetitions on one side and then the other, or you can even do both at the same time, bringing it out to the side. Again, make sure that you keep your shoulder blades back and down, because usually as you get tired, the shoulders tend to creep up towards your ears. A general guideline for increasing the weights would be when you are able to do 20 repetitions without too much fatigue and certainly no pain or swelling, you can increase by another pound the next time you do the exercises. The general guidelines for beginning and progressing exercise after breast cancer surgery are basically the same as for anyone who has underlying health issues. You have to start by listening to your body. Follow the advice of your healthcare team. Be kind to yourself. Recognize that people heal at different rates, and the response to cancer treatment is very individual. Your energy level and ability will vary also from day to day. There are many causes and contributions to both psychological and physical stress. Some of these stressors include dealing with the shock of the diagnosis of the big C. There is a lot of energy that is required to heal from the surgery itself. Scheduling and attending appointments can be a full-time job. Dealing with financial pressures, especially if you are self-employed, can be very tremendous. Changing expectations of your role, whether it be as mother, wife, friend, employee, boss, whatever you did before your illness, can be a major stressor. Needing to rely on others for help can be very difficult for people who are extremely independent. Recuperating from the side effects of chemotherapy and/or radiation can be very taxing. Often the cumulative effects of these treatments is underestimated. Worrying about what the future holds can be very tiring, as no one holds a crystal ball. Accepting changes in appearance, whether it's short-term or long-term, such as hair loss or the loss of a breast or breasts. Making decisions about the future, including possible reconstructive breast surgery and/or paths of treatment, if and when to return to work, and so on, is very tiring. There are many things that you can do to help to combat fatigue. Balancing rest with exercise. Don't do too much. Talk to your healthcare professionals and ask questions to make informed decisions. It often helps to have a buddy with you to hear those answers with a second set of ears. Ask for assistance with the patient care navigators if they're available in your area. Avail of any employee assistance programs if they have them available through your work. Accept help from your colleagues, from your friends, from your family. Don't turn down offers of extra casseroles. Eat well Your body needs good fuel to help to heal itself. Get adequate sleep. For the short term, sometimes medication is necessary to help to give you a good night's sleep, so it may be necessary to speak with your family doctor about this. Relaxation exercises can help to clear the mind. Positive self-talk, focusing on the positive things in your life, can help to energize you. Don't sweat the small stuff. Do something you enjoy. Laughing truly is one of the best medicines. Exercise, as we have covered in this video, including your flexibility exercise, your range of motion, your strengthening exercise, your endurance, helps to build energy reserves. Here are some hints for progression of exercises. First, find a time of day that works for you. It may be after a shower in the morning, or maybe later in the day when things are quiet. Wear comfortable clothing and good supportive footwear, especially if you're walking. It's often easier to exercise with a buddy to keep you motivated and for company. Set small goals. You may have lofty goals, but you want to make small steps to get to them. Start slowly and give yourself a chance to assess your body's response to the exercises before you progress them. Rest before you have to. Don't wait until you're exhausted. Always be able to carry on a conversation while you're exercising to show that you're not doing too much. Don't go into pain, just work towards gentle fatigue. Progress slowly. Try to build up a bit every day so that you're eventually doing 30 to 60 minutes of activity every day. Keep a diary to show your progress. Talk to your physiotherapist if you have any problems so that you can modify your program to suit your needs. Choose activities that you like to do and progress them at your own tolerance. Some suggestions for activities may include walking. You may try to use some Nordic walking poles to help you with your upper body fitness and give you some extra support. Swimming, dragon boating, cycling, either static exercises or on a road. Remember to report to your healthcare team if you have any of the following symptoms: any increases in shortness of breath, increased fatigue, any chest pain, fever, signs of infection, limb or chest swelling. We wish you good luck with your exercise, and remember to be kind to yourself. In this section, we have some testimonials of women who have gone through the breast cancer experience. They hope that by sharing some of their coping techniques and testimonials, that they will give you some ideas as to how to cope with your own health situation. We wish you well.
Well, we were going into Subway, and my family doctor called me. I'll never forget looking at Carl's face. He was the worst. And my daughter and son-in-law was with us, and I said, well, it's go. And she said, no, Mom, you'll get through this. You're going to have your Subway. We sat down. We did have Subway, but I didn't eat anything. And but every day it got a little bit easier until one day we were painting at my son's house. Carl was painting, and I went in the room and I seen him crying to break his heart, and that was the worst day we had. The two of us were crying together, and all that day we couldn't get over it. But after that, two of us got really strong. Were you? You're strong. You're strong. You're trying to be strong. Then we went to our appointments, and the not knowing, I think, was the worst. Not knowing if I was going to have an allergic reaction, because I had reactions to every pills and drugs, and I'm allergic to X-ray contrast dyes. I was really nervous over going to sleep, and I kept asking the doctor to make sure that I'm not going to be really sick. But when I came to, I was so hyper, I was waving to everyone and saying, here, I'm back, I'm back. And I was really hyper. And we left the hospital in about an hour after I had surgery. And after that, I was on cloud nine that I just woke up, I think. And just to be alive with my family and my friends, I'm just glad to be alive. Go camping now, I can't wait. I really surprised my own self. As soon as I looked at when she took out the drainage, it didn't bother me. I never cried or anything. I just went on, and everyone is really good, my family, trying to help me. And my sister-in-law made bras for me and stuff like that. And I feel good about myself. I don't see where I'm any different. In the morning time, we get up and I do my exercises. And then if I felt like it, we went for a drive or went to a movie. And physio was the best thing ever made. My physio teacher's the best. And we just stays with family and does family outings. And physio is really good because, like, even home, you got to do your physio. I lie on the bed and does mine, and my husband, he put the line on the curtain rod, and I was doing my exercise on the curtain rod. Yeah, the pulley one. And we had the walking stick, and I used to do it with that. And the ball, try to check your posture on every straight, but he was always telling me to put the pillow under my arm to do the posture that the physio helps show you how to do. And like when you're sitting down watching TV, you should have a pillow under your arm and keep it out, but use your posture right. And you keep walking around, but not too much on the first of it. Like when you get tired, give in and lie down. Even though you want to slouch, you should really do your physio. And if you want to, feels like you should be lying down, do your exercise while you're lying down. And you'll feel a lot better after. So it's very important to do your physio while you're recovering.
She got a good attitude.
Yeah.
Yeah.
Yeah, we got a good attitude together, and we always spent time together, didn't we, dear?
Oh, yeah.
Yeah. And he takes me to movies, and we go for drives. If I feel like I just want to get out, we'll go for a drive or something.
Yeah.
He is my best buddy. Accepting the offers of help is the best thing, and my daughter and husband were really good to me. They done all the drainage, took all that out, and I tries to have a positive attitude and to be good to other people. Yeah, we're doing good. Wonderful.
On September the 19th, 2014, I had a scheduled mammogram. So I went in for my mammogram thinking it was quite normal, like all the others that I had. And several days afterwards, I had a call from my family doctor saying that he was going to schedule me for what was called a spot view mammogram because there was some questionable distortion. And I really still didn't think very much of that because normally I find the mammograms very difficult. I have dense breasts and it's very painful when I'm having the mammograms. And on this particular mammogram, it was really easy. And I even made a comment to the technician that she was very easy on me that day. So I had to spot view, and several days afterwards, I received another call from my family doctor saying that he was scheduling me for a biopsy. And so from there, I was diagnosed with invasive DCIS, a ductal carcinoma. The day, as I said in the beginning, I didn't think much of it, but the day that I received the call after I had the biopsy, Adrian and I were waiting all day for that call. And when it came, it was shocking. You know, all those years when I was having mammograms, I never thought it would be something like this because there's no history of breast cancer in our family. I had a meeting with my surgeon, and Adrian and our daughter, Dorothy Jane, came with me, and I had a lot of questions prepared. And he answered all my questions. He drew diagrams for me. He explained everything in great detail. And when we left that evening, we really felt very comfortable, very empowered to be able to make a decision as to whether I was going to go with a mastectomy or with the lumpectomy or the breast conserving surgery. He gave me a booklet, a guide for patients with breast cancer, and that was magnificent. It was wonderful. I educated myself a lot, and everything I read, I gave to Adrian to read. The fact that he sat in on the meeting with the surgeon, you know, helped him understand a great deal about what was going on. It was very, very difficult to make the decision. You know, you have two choices. You know, you go either with the mastectomy or the lumpectomy. So you can only make a decision based on the information that you have at the time and what's best, you know, for me, what was best for me. I sort of had my mind made up. I was going to go with the breast conserving surgery. And so when someone else would say to me, well, you know, I think you should have a mastectomy, I found that difficult. But by educating myself and by doing all the reading and by all of the discussion with other healthcare professionals, I made a decision, and I'm not sorry for making it. The nurses were really, really very good, very helpful, and all of the technicians. As part of the pre-op procedure, I did see a physiotherapist, and I was very, very happy with the treatment that I received from my physiotherapist. She was absolutely wonderful. I received a booklet and all kinds of little instruments that I could use for my physiotherapy. My second surgery, where there was a cavity where the carcinoma had been removed, the cavity filled with fluid, so I had a seroma, and that was very painful, and I was very anxious because I didn't know what it was. And I had to go back to my physiotherapist, and she worked diligently to resolve the issue and get me back to good health again, and certainly gave me a great deal of confidence in terms of my own ability to exercise and do the massaging and get me back on track again. 3 months after my radiation treatments, a tremendous amount of fluid in my breast, and I had to return to my physiotherapist again, who went over all of the exercises, gave me new exercises, showed me new techniques for massaging, and even went so far as to suggest particular types of clothing that would assist in a more speedy or a faster return to good health. Doing all the exercises now, and I can see every day more and more improvements. Since I started doing the exercising and the massaging, my range of motion on the left side of my body is almost as good as the right side of my body. It's practically back to normal again. I have a routine in that I do my exercises, if possible, 3 times a day, and certainly do the massaging 3, sometimes 4 times a day.
When that came, I just couldn't believe it, because she was having the mammograms every year, and then it went to 2 years, and she'd always be checking to see if there was any lumps or anything. And when we went to the health science and we met with the doctor, and she said, you don't have to have chemo. Well, that was a blessing. You know, you're always questioning and wondering, and she was wonderful through it, I must say, and I tried to help her as much as I could.
I was only as strong as my partner. But you have to be pretty strong when you get breakfast in bed every day, and and your supper cooked in the evening, and so he was very, very good. I never would have survived without him.
And I have to say that I don't think the service was any better in any other part of the world than it was here.
I guess my attitude has changed a lot in terms of how I feel about life and good health. And so every day I'm very, very grateful that I have the opportunity to celebrate life with my children, with Adrian, with my grandchildren. And I tend to enjoy even the most simplest things of life these days. I think I've conquered this. For other people who have to take this journey that I've already taken, don't ever cancel a mammogram or give up on a mammogram or change your mind or anything. Because when I was scheduled for this mammogram, we had a family outing that we had planned, and I had decided I was going to cancel my mammogram. And something just kept nagging at me and telling me. And anyway, I decided I would go ahead with my mammogram and I would join the family afterwards. And that's what I did. The other thing I would like to say for those who, again, have to take this journey, don't be afraid, because the team of health professionals are I would consider to be the best in the world. You get so much care, so much compassion. The professionals are competent, so professional in the way they deal with you that if you have breast cancer or any other type of cancer, you can be assured that you're getting the best possible care. I had no complications with the surgery itself. The incision was so small, and I was surprised at that, and it healed so well. It was the complications afterwards, and the physiotherapy is so important to get you through that stage.
January 13th, 2015 of this year, I had my mammogram, and something showed. I waited 3 weeks for a biopsy. During that time, I kept telling myself everything was going to be okay, because during the ultrasound they also looked at my lymph nodes, and they said my lymph nodes looked fantastic and looked clear. I heard from my family doctor. He walked in the room and he told me it was invasive ductal carcinoma. I called my husband on my cell phone, and I told him the news. The first words my mother said was, "Don't worry, it's going to be all fine. They'll just cut that out, Lisa. You'll be just fine."
Really didn't expect it. From the little bit I knew, there was no family history, and so that would have been about the same as getting hit with a sledgehammer.
His reaction wasn't as strong as Addie's. She's just at that stage where she's developing her breast, and I'm, here I am at the stage of losing, one of mine. One of her big fears was, "Mommy," I remember her saying, "Mommy, are you going to lose your hair?" And of course, hair is very important to a 13-year-old. And for me, it was like, am I going to lose my life? So at the time, we only knew of 2 lesions. So the surgeon suggested that I'd have an MRI. And the MRI showed 3 spots. So I had 2 in the 8 o'clock area, and I had another really small one in the 6:30 area. Our surgeon was fantastic. I felt very comfortable with him. He and I came to the agreement that because it was multifocal, that it would be best to remove the entire breast. Once we found out that I would need a mastectomy, I contacted a friend of Dean's, and she told me exactly what to expect.
Surprised at Lisa's positivity, and frankly surprised at how quickly she wanted it done.
I found personal hygiene very hard, because my breast was really sore. So of course, once I took off my bra, I wouldn't have that support. And getting into the shower was extremely hard, because not only did I still feel the pain because of the lack of support, I also had to look at a breast that had cancer in it. And that was very devastating for me. Getting up in the mornings and facing showers, which is a normal, everyday thing that we do that, you know, we normally enjoy, became very upsetting for me, because I would have to wash around that area, and when I washed there, I could feel the lump. And the lady who I was confiding in, Lisa, she said, 4 weeks, she said, that's nothing. She said, you get to spend Easter with your family. She said, Abby's birthday's in there. She said, and Abby won't remember her 13th birthday as a time when Mommy was ill. You know, one choice, I could have sat in a corner and cried and spent all my time there, or get up and move on and live life to the fullest and to make it as normal as possible for my children. So Dean has been by my side since the very beginning. But this year, we've gone through a lot together.
Either useful to Lisa or to the kids or to anything I could do, even after surgery. Some of the, doing the drainage tubes. It was nice to be useful.
You know, Dean will say sometimes, like, Lisa, do you really need to be reassured on everything? You know what? I do. At this point, I do. I always felt that during the waiting time that the cancer was growing.
Even when you can sometimes force it in the back of your mind when you need to stay on task, it's always there.
Yes.
And it's quite a roller coaster.
But we were always given the impression that, you know, things were going to be okay. I'm still going through the process. I still don't know about chemo. I'm still waiting on test results. We saw one of the specialists today, and we know that I'm not going to be requiring radiation.
Asking the questions and doing some independent research, you know, we know that the survival rate is quite high in this particular type of breast cancer.
So we laugh through this process as well. We have to laugh, because if you don't laugh, I mean, it's all you'd be doing is crying. I didn't always look after my health. You know, I wasn't really exercising. When I got my diagnosis on February 20th, I made a commitment to myself. Taking care of your health, exercising, eating properly certainly has a huge impact, because research has shown that leading a healthy lifestyle will reduce reoccurrences, which is what we're all about. During my pre-admission, I had the opportunity to meet with a wonderful physiotherapist. She told me all kinds of information that I had no idea about. First of all, I didn't even realize that I had to see a physiotherapist after I had my breast removed. I remember waking up from surgery and remembering some of the things that she had told me. She said, now start moving your hands, moving your fingers, making fists. Following the instructions of the physiotherapist was only going to make me stronger. She knew about my body, and she knew exactly what was going to happen. And she was all prepared, and she gave me a book. She gave me a heart-shaped pillow that I could put underneath my arm so I could rest my arm on. She gave me a little ball that I could squeeze, and she gave me a rope for doing different types of exercises on the door. She warned me that if I didn't do them, that I would not progress. She was just amazing. She really, really helped me out. You can't fool the physiotherapist. They know exactly what you're doing and what you're not doing. I've never had anxiety before in my life, but now since my diagnosis, I do have some anxiety. And my physiotherapist said that she's never seen anyone squirm as much as me before in her life. And the scar actually looks beautiful. Sometimes I feel like my breast is still there. I think they might call it phantom breast. I don't feel like it's gone. I feel like I am a full person. I don't feel like I'm missing a body part at all. To help with the stress, I do deep breathe. It also opens up my chest and stretches around my scar as well, so that's all really good for me. When you're diagnosed with cancer, you think the worst. I didn't really have any pain with the mastectomy. Dean has been an inspiration, I have to say. I have often asked him before the mastectomy, I said, you know, are things going to change? You know, how are you going to feel about this? And he's often said to me, he said, like, Lisa, you know, we've been together for 20 years. He said, you know, I hope you don't think things are going to change because you're losing your breast. You know, losing your breast is certainly not ideal. But you know what, we're going to make it, and we're going to be just fine. You know, 10 to 7 in the morning to get the kids ready for school, and there'll be messages from my colleagues on the phone saying, I just got up, just thinking about you, hope you're going to have a wonderful day. Those little things that takes 2 seconds from a person to send to another person, costs absolutely nothing, are things that really meant a lot to me. And my whole staff told me that they would join me at the Run for the Cure in October, and we'd go as a team. And I'm really looking forward to that. And we can do for ourselves, and there's something that we can do for our children, and there's something that we can do for our grandchildren. Right? We can run for the cure. You know, you have to do things you have to get up, you have to move, you have to get yourself better. I had a 9-year-old, I had a 12-year-old. I was not going to let my husband raise those kids on his own. We don't talk about mommy being sick. Everything is normal at home. We walk together, we take the dog and the kids go on their bikes. I actually saw a dietitian today and she calmed down a lot of my anxieties. She told me that if I have a piece of chocolate or if I have a bit of sugar, it's going to be okay and the cancer is not going to come back immediately and I'm going to be okay. It took 44 years for me to get breast cancer. It may take 44 years for it to come back again. If I could make a change in just one person's life, I'd be so happy. I really will, or I really would. I just hope that I can be a support to someone else. We're women, we have 2 breasts. We want to keep those 2 breasts, but if we can't, we want to support each other through this breast cancer journey.
Your feedback regarding this video project would be greatly appreciated. Please feel free to send any of your comments to St. Clair's Physiotherapy, Eastern Health, Le Marchant Road, St. John's, Newfoundland.